So thank you very much for coming to our LEC seminar today. Welcome to Lancaster Environment Centre at Lancaster University. I'm Ali Burkitt. I have the pleasure of facilitating the seminar programme here at LEC. Please keep an eye on the website, on the events section of the website, which is About Us, under About Us. There we share all of the details of our events and activities, and all of the LEC programme, the LEC seminar programme will be up there. And if you are joining us on YouTube, don't forget to click on our subscription button and to tick the notification bell so that you know when new videos go live. That's all the notices that I have for today. So I have the pleasure of handing over to Dr. Manoj Roy, who's the chair of our session and will introduce our speakers and manage the session.
Many thanks, Ali. Thank you very much for tuning in to this LEC seminar. So my name is Manoj Roy. I can see most of you probably know from the audience, so there is not much to say more than that you know about me. But to say that today we have got the pleasure of presenting two substantially large research projects, and particularly the way we have been able to navigate those projects during the COVID pandemic. And the projects, as you will hear from our speaker, also was an unique opportunity to examine that some projects which were started before, well before the pandemic's onset, and other kind of really started as the pandemic deepened. So we had the opportunity to sort of see how the early work in one research helped us continue, and whilst the other research, how we actually were able to sort of go to the field. The other most important satisfying position also is to say that I am, being a southern researcher, was able to work with the northern researcher, but more importantly, had the privilege of working alongside two southern researchers. We were lucky that these southern researchers were coming from the very countries that we were doing our research in. So we had real privilege to actually to see the benefit of having southern researcher kind of represented at every nodes of international development research. I must say that today we have seen that there are three people mentioned here, but this project has substantially large team. So we probably would not be able to sort of credit those colleagues here one by one, but we have deep respect and for the time they have given to this project, and we do very much appreciate their contribution. Today, though, I have the privilege to again introduce two of our southern researchers based in Lancaster University. So I invite them to sort of first introduce themselves before they start their presentation. So Reuben Larbi, Dr. Reuben Larbi, could you talk just 30 seconds about yourself, please?
Okay, so thank you, Manoj. So my name is Reuben Larbi. I'm a postdoctoral research associate at the Lancaster Environment Center here. I joined the RECIRCULATE project in 2018 when I completed my PhD, and just last year in October, I shifted from the RECIRCULATE project to a different one, which is concrete impact, which I work together with Benjamin Neymark and others in the Lancaster Environment Center. So briefly, that's an introduction.
Thanks, Reuben. Somehow there is a background noise from your end. I don't know whether there is multiple device open. If you may sort of have a look into it. So can I just now invite Dr. Ehsanul Kabir to just say 30 seconds about yourself, please.
Thank you, Dr. Manoj. My name is Ehsan. I'm working at Lancaster Environment Center is almost 2 years now, and my main focus is at Living Delta Hub, which is a large research project, and I'm particularly focusing on changes in livelihood and in environmentally challenges locations across the river deltas in Asia. So this includes countries such as Bangladesh, India, Vietnam. It's great to be here. Thank you.
Okay, thank you very much. So over to you, colleagues. Take us through what you have to say for this presentation then. I remain muted unless there is a need for me to step in. Okay, thank you.
We're getting really bad feedback off your mic, Reuben. I don't know whether maybe you'd be able to use to go to Ehsan's computer instead.
Okay. So we are looking at how COVID-19 has revealed the value of early local ownership of international development research. We'll be drawing from two major research projects, that's the RECIRCULATE and the Living Data Hub. So we'll be interchanging the presentation at some point. So mainly, international development research has been through donor-funded agencies. So mainly it's through the
Next slide, please.
Okay, mainly through the giving of donor funds to developing countries, which is implemented in diverse ways, mostly through research activism. So we are using the term research activism to capture the act of researchers from the north and south, together with local duty bearers, implementing research activities in the local context. So a review of this kind of research showed a high failure rate. Failure rate means that the project couldn't achieve the intended objectives. So about 50% of research done in Africa had failure rates compared to 40 elsewhere. And this was mainly World Bank funded research projects. There has been renewed emphasis on the need for co-production as against the traditional way of researchers from the north or conducting research in the south. So the GCRF, for example, admonishes the doing of research with, in, and for local communities. So both researchers and scientists from the north and south, together with local communities, carry out research in the local communities to co-produce knowledge, as against the conventional, traditional way of scientists versus the research, that is the local communities. And we see that COVID-19 has brought major challenges to this new approach of doing research, that is involving local communities to co-produce knowledge. Mainly, I think, as most of us will be aware, there were major funding cuts during the COVID project, which I think a lot of research projects may have been affected. Also, in-person research activism stalled due to travel restrictions, and people had to isolate and all that. And there was also the need to develop very robust implementable research methods to fill this caveat. So there was the need for very resilient research approaches to navigate the challenges that were posed by the COVID-19 pandemic. Specifically, this notion of doing research with, in, and for communities became a real challenge because of the restrictions on traveling and the need to move together with local communities. So against this backdrop, we are bringing our experience from how we build early local ownership with the two research projects, one done in the South Asia and other in West Africa, how we managed to work together with local communities and researchers in the South to navigate the challenges that were posed by COVID-19 pandemic. So the question we want to ask here is, why do we need local ownership, and why should it be early? So it's been noted that Southern researchers hold superior contextual knowledge. So they know the context very well. But the purist definition of academic research, where it's researchers from the north conducting research in the south, tend to be ill-suited for this, drawing on this deep contextual knowledge that the West Southerners possess. And international development research suffers from this, mainly because researchers from the north tend to have the resources and so have major control over the research process, as against those with the real local knowledge on the ground. And this binary tends to impede the potential success of research, international development research. So gradually there is a shift from this public education model to a more inclusive model that is called co-production of knowledge, which probably we may have heard about, and specifically the Swiss knowledge transfer developed 11 principles to enhance this one. So it brings out the need to do research from the early stages to the research is completed, and that helps to bring out the early notion. So we are building early local ownership now, and we see it as a duty rather than an aspiration. It's something that all researchers see it as a duty to make research local rather than a mere aspiration. So looking at our two research projects, the first is RECIRCULATE on the top, and the bottom one is the Living Deltas Hub. We are showing the scale when the project started and the current stages and when COVID-19 came in. So the top part, which is RECIRCULATE, we see that there was a lot of capacity building, that is knowledge creation and co-development of concepts and methodology with researchers in the South before the COVID-19 pandemic. So after the pandemic, during and after the pandemic, we were having blended research activities, so working together with local researchers based on the capacity that had been built already. The Deltas Hub, on the other hand, COVID set in few months after it was launched, and so the Deltas Hub also adopted a different strategy to enhance the research process. So we will be looking at the details of this. I'll pass on to Ehsan to give the details of how the Deltas Hub went about this particular process.
Thank you, Reuben. And apologies for background noise in the beginning, though we actually miss the real seminar room. But today, the good part is actually me and Reuben are sitting in the same room, actually. We were collaboratively working together, preparing these presentations, and that's why you can see us actually changing chair. Now, the idea of research collective, let me just very quickly introduce what we are arguing and what does it mean, like, by research collective. Now, a dynamic team can form a research collective which requires an effective communication, brainstorming, and collaborative efforts by its members. In other words, a research collective involves active participation and collaboration of the researchers and decision makers whose viewpoints are considered. While research collective includes different individuals, groups, and institutions involved in the production of knowledge, it must not exclude local community, practitioners, organizations, and other stakeholders. The latter play key role in translating research into actions. Moreover, any other individuals or groups mediating this research should also be included. Now, in brief, by research collective, we are saying it requires well-functioning network of scholars and their collaboration with other practitioners, policymakers, and beneficiaries. And also different studies show that if the research is adopted in the community, it's well conceived in within the other stakeholders from the beginning, the findings can be easily accepted and implemented by the stakeholders when the outcomes are coming. So that's why we are arguing for a pluralistic model of collaboration. Now, like, this is a diagram showing it represents research collective concept. You can see we include in our research, we believe incorporating local government or duty bearers, but at the same time, private sectors, local industries, and local NGOs in development research. They have very good infrastructures in many places. Local research institutions, it can include independent research institutions and universities as well. And also on the right, you can see research activists like Southern-based researchers working with Western scholars. So Southern researchers who are geographically located in Southern and also who are geographically located in other countries like Northern countries, along with other Western scholars. And in the middle, you can see local community context that we explored, like for our research, like these points were very important. Community-based organizations, adolescents, youth, in-situ entrepreneurs, and coalition of key informants. So we did this in a very participatory way. We are doing actually, sorry. Now you can see two evidence. Basically, you can consider this as two case studies. One is from Bangladesh, the other case studies from Ghana. Bangladesh case study is run is empowered by Living Delta Research Hub. It's a very big project, and in brief we call it Hub. The Hub, it's looking at patterns and shift in Delta livelihoods with a specific focus on youth in entrepreneurs or youth entrepreneurs' role in diversifying livelihood. And in Ghana, you can see the project's aims examining sanitation for water and health in low-income urban settlements. Now, Reuben, would you like to actually talk about Ghana project first? Then I can come back and talk about Bangladesh, and actually that's how we can finish.
Okay. So just to add some context to it, the RECIRCULATE project is implemented in Ghana and other African countries. But this part of the research was done specifically in Ghana, in Accra. So the study context is in Accra. Just to understand the way we developed the research collective that Ehsan just mentioned, and the capacity building component, we are showing this escalator model of training and capacity building. And it shows from the inception of the project to the current stage, how capacity was developed at different stages and how this has enhanced involvement of our research collective in implementing the project. So to my right, we see the green arrow pointing downwards, and the arrow gets deepened as it gets to the bottom. So the top is a bit faint and the down is a bit darkened, and that shows the intensity of the capacity building. That's the host institution's capacity building. So we have local host institution, a research institution, we have NGOs and all the others. So there were a couple of trainings, inception workshop to develop the methodology and concepts together. So at the initial stages, year one, we see that the knowledge base was lower. So it's shown as faint green. And as we went on with residency programs where researchers from the South spent some time in the UK, we had workshops, creative imagination workshop where we developed methodologies and concepts. The knowledge base or the capacity to implement the projects was enhanced. So we see it getting darkened as it moves below. And this enhanced the capacity of the local researchers, which we are referring to as the research collective, to implement the research in the face of the COVID-19 pandemic. So major issues arising with the RECIRCULATE, before I pass on to Ehsan, is because of the nature of the training or the capacity building and the co-production of knowledge. Even through the pandemic, we collected data through a blended research, we blended both in-person and online approach, and with very minimal interruption to the research process. And we think that that's a major achievement or major success. However, there are a few things we want to highlight. So the technology was not always smooth, and we use Cisco Java for interviewing respondents, and sometimes the people will not hear you very clearly and all that. And another thing we are referring to as the stranger conversation effect is when people cannot see you, probably they have not seen you in person, and you are interviewing them specifically about their lived experiences of water sanitation. It could be challenging, and we had a few issues with that. Sometimes interviews were ended halfway till our local researchers went in to continue the interview. So, we had the missing contextual observation and body expression. So just as collecting any other data, you want to have a feel of people's body expressions and contextual knowledge. Like you want to know about water and they are pointing to a particular place, but because you are on the phone, you can't see what they are pointing to. So these were the things that were missing out from our research. But on the whole, this does not compromise the research data quality or process significantly. So I'll pass on to Ehsan to give some details about the hub.
There's some 5 minutes. Yeah.
All right. Okay. Thank you, Manoj. So thank you, Reuben. Now, living Delta, like our reality was slightly different than RECIRCULATE because we started our work and then pandemic also came almost in the same time. Like it was very challenging, like how to begin. So in the on the top, you can see the timeline of different challenges and how we actually responded to different challenges. Now, in 2000, like we started actually when the overseas travel became very constant and travel restrictions were everywhere. Then we started consulting local stakeholders in Bangladesh, particularly because our main focus is Bangladesh, India, and Vietnam. We're planning to implement same model in India and Vietnam, possibly Vietnam, but also in India. Now we started talking with different stakeholders in Bangladesh. That consultation took a lot of time actually because it went through a lot of consultations, discussions, and also trying to develop a common consensus what we're trying to do and how it complements each of these stakeholders' common interest. Now our consultation took a bit of while, almost like 1 year, like if not 1 year, actually 8 to 10 months, consulting different stakeholders and who are really interested in research. Many of them actually welcome us as a Lancaster University and Living Delta to actually sign MOU with them for common interests. Like they also want to know the outcome of this research for their future development project, for example. And also they want to implement, they also, and some of them are already conducting some research, all of these partner organizations. Now, on the diagram, you can see most of these are NGOs, 6 of them are local NGOs. And at the bottom left, CPRD is a research organization. So we built MOU, Memorandum of Understanding with 7 organizations, 6 organizations, I apologize, during September 2021. And right after that, we launched our fieldwork. And on the right, you can see our fieldwork, which we are calling 3D approach, like dialogue, diary, and also detailed storytelling. Now, at the bottom, detailed stories are basically in-depth interview. Each of these stories involve multiple interview of one or another person or more persons to establish their cases. Dialogues are basically bottom-up dialogue, which means which include 5 regional dialogue followed by 1 national dialogue, where we're trying to generate data. We're encouraging participants from different stakes to participate in dialogues, and through that we collect data. We apply breakout sessions and other methodologies, surveys and other methodologies in each of the dialogues, and that's how data is generated. In previous slide, I think the map was shown. You can see different locations actually in Bangladesh map where dialogues have been conducted, and we are collecting data as well. Now, coming back to my current slide, diary is a longitudinal diary, and longitudinal diary is actually to collect details of livelihood of people who are living across Delta region, different parts of the country. So we are having 30 households in each location, and we're covering 6 different locations where households are writing or giving inputs on their livelihood activities on daily basis. So how these households are selected? These household locations are actually common area where our NGO partners are actually intervening or conducting their development activities. We did initially participatory GIS approach, and followed by that we developed different vulnerability scales, and based on that and income categories, we selected individuals. And regarding the workshop, I told you, like we already conducted 5 local dialogues in 5 different locations where our NGOs and partners, they took leadership, they shared leadership with us. So they actually came forward and actually co-facilitated this dialogue, whereas actually we were participating from here. But it required a lot of consultations from the beginning till actually end, how it is going to be happen and how data will be generated, how the breakout sessions and facilitation will take place, and so on. Now, if we look at the field work, like we already produced 3 months diary data. Month 4 will be due in actually next 4 days. And we are planning to continue this diary fieldwork, which is a ethnographic fieldwork, for 1 year. Dialogues, regarding dialogues, 5 regional dialogues are done, and 1 national dialogue will be done by April. Due to COVID restriction, we're just giving it a bit pause. And our interview case stories, most of these are based on online, but at the same time, we have researcher in Bangladesh who is visiting and also doing follow-up interviews. Now, I'm moving on because we don't have much time. This picture is actually we borrowed from Professor Andy Large, who leads Living Delta Hub research. This is exactly how the MOU. He used this slide in actually presentation showing how MOU is being signed. Now, these are the activities we completed so far, like diary household. As I told you, ethnographic diary, people are giving input. So 100 household is being covered, and for 360 days, 65 days for 1 year. Already we covered 4 months. Now dialogues, five local dialogues have been completed. 1 national dialogue is due in April, and detailed stories where so far we have interviewed 20, but we are developing and modifying those interviews, and we are hoping to do some more. Now, at the same time, our communication and our activities through our partner reach over 2 million households actually in Bangladesh. How? Through local newspaper, national newspaper, online portal, radio, and other media. Interestingly, 2 of our partners have local radios. One of them is very instrumental. It is the audienship is very high because it disseminated disaster early warning in coastal area. So like those radios are very well listened, and actually they are also telling about our programs and key messages. And we're also planning to do some radio programs, some further radio programs in coming months. Now these pictures are from bottom-up dialogues, five regional dialogues that took place where participants generated like their ideas, co-produced their knowledge. And next slide, this is actually livelihood diary, where actually diary was given, and people, it was all in Bangla. So when the diary was created, like the consultation with local stakeholders took place in Bangla. We developed a diary in Bangla language first, because that's how we were able to conceptualize culture and heritage. And then like we translated into English to share with other colleagues. And this diary is being continuously written, and on the map you can see like 6 locations once again where these diary inputs are actually being collected. Some issues arising, as Reuben said, we are also having some issues. I'm nearly end, like this is my before last slide. So one issue we understood is households' perception of this research, because we were very cautious, and it took and it's taking a lot of effort to establish our researcher identity, because we are not development organizations, we are researcher. Development organizations and industry, they are our partner, and the purpose is pure research, not to benefit in cash or kind to the beneficiary. So this is where actually we are doing a lot of groundwork. And also persistent dialogue or drop-in session with partners, NGO field work with NGO field workers particularly, where We are on WhatsApp group chat and also running weekly dropping sessions and even like more than one dropping sessions per week, just to make sure that they understand every message and they are on same line. And we also invite our participants to join on Zoom meetings so that like we can communicate through our partners and in a spontaneous schedule. Trust building was a process because we can see our diary input is getting better from first month to second month, and again further better in third month. So we understand that like they're building trust when they're giving their inputs, our households, our participants. And logistics, like the logistics is common thing like transportation and other things, collecting diaries from one location to another. So yeah. In conclusion, just few things like data collected with minimal interruption, although UK researchers could not travel during lockdown. I'm doing this on behalf of Reuben as well. Effective inter-stakeholder collaboration to co-implement the project, and created a functioning academic industry and NGO linkage to implement integrated research project. And as you know, we are advocating for research collective, and like this is how we are showing the research collective is actually taking shape and becoming actually productive, and a mixed approach of virtual and in-person continuation in continuous revision. Actually, we are always rectifying our work because there must be always some error, and we acknowledge those shortcomings. We appreciate those errors and troubles and challenges, and we're continuously trying to overcome various difficulties. So that's all we wanted to share. Is that all, Reuben? Okay, thank you very much. So thank you for listening, and over to you, Manoj.
Thank you very much, Ehsan and Reuben, for taking us through the presentation. Now, I think I'm waiting for questions. I have already one question posted in the chat. So the request for everyone to sort of ask some tricky question, maybe. Of course, we can appreciate lots of hard work that's being done by the colleagues in there. So Francis is asking a very important question that, the understanding of the power dynamics of the different cases. Clearly the research collaboration is made up of unequal partners. How did we actually mitigate these? And also the online interview or collaborative meetings prevent us from picking up the contextual clues and power relations that you also admitted, Ehsan. So how do you actually deal with this power structure and the missing contextual information?
Okay, so we were very sensitive. Number one, thank you very much, Francis, for asking this question. We were very sensitive and actually patient. Like when choosing those NGOs, we actually verified whether who is having power struggle or tension with who. And that took us, like we started 2020 and we signed MOU September 2021. So we did, like Manoj and me, and actually there's another colleague from Bangladesh. We did many meetings actually with each of the NGOs. But before actually meeting them, we were consulting some other institutions to know a lot details about each of these organizations. So we took recommendation from government agencies as well about the reputation and who are actually doing what in terms of performance, honesty, and transparency, and other things in the field. And we were introduced by very reputed umbrella institutions in the government who works with them as well. So it's just for reputation, but just we were very humble and we talked with each of the NGO representatives. A lot of dialogue took place, but at the same time, we try to see if we try to make sure that there's no tension between each of these persons. That was one way actually we try to mitigate the tension between these different organizations. Number two that we did, we always offered them a leadership. When after MOU, when MOU was signed, even before MOU was signed, we always did collaboration. But when we were implementing to the field, we never showed that we are dictating anything. So when the dialogue was taking place, for example, regional dialogue, all the contents were developed in collaboration and in consultation, and it took place in Bangla. And same thing happened with diary fieldwork. The content was shared with them. We gathered their knowledge. When we select sampling, we did participatory GIS to actually invite them to actually show which are the locations they think will be appropriate. And that's how we try to mitigate tension during the immersion phase, actually, from the beginning, so that they feel the ownership of the project. And also we have some money, which is for logistics, a little bit amount of money, which makes them a bit flexible in terms of paying for travel, paying for some expenditures in the field. Is that what answered Francis' question?
Yeah, I think you covered it. Let's see if there are some other question. Otherwise, we can sort of come back to this very important question, though. Yeah, Nikita was asking that with regards to the diary input, did we face any challenges in terms of maintaining the interest and the autonomy of the households in writing their diaries? So there are two components here: maintaining their interest in writing it, and then how autonomous were they, when they wrote the diaries. So if you could reflect, I think this also belongs to Living Delta's hub, Ehsan.
Okay, thank you. Very interesting question, Nikita. Like when it is about interest, it varies from person to person. I'll be very frank here. Like, and also across the locations. Like in some locations, people accepted that in one go, that this is very interesting. In some other locations, it was not that easy because people were asking critical questions and how it would be aligned with their interest. Exactly what you are asking. Now coming to the first one, when like in some locations it was very well accepted, like where in remote island areas, we call it Chor Island. In Chor or remote areas in the northern part, people accepted that very easily and very quickly. They said, you are the first group of people coming here and asking about our life. And like a lot of them don't have television, newspapers, internets, and other entertainment. When they found diary, they said, wow, we're going to write about ourselves. We are feeling kind of like being heard by others and like read by others, really. So in some locations, it was accepted that level, up to that level. In some other locations, which are having more benefits or people are having diverse interests, like we had to actually really consult, and it took time to make them understand that there's nothing wrong in actually giving. We always took consent, we always took permission, but at the same time, people sometimes took a bit of time to actually believe and trust fully that it is aligned with their interests. So as I told, in some location, first 2 weeks or first month was not as good as second month is. Now, coming to second question, autonomous. It was also heavily variable. Like it depended on literacy, it depended on gender, it depended on age group, who is writing that diary. Like when there is no literacy in the family, but a young girl or young boy, adolescent, 13 years old, is able to write, she's writing it. Now, that's how it is going. And in some area, the household head is writing this, but in some area, son or daughter in the family is writing it. But in only few cases, 7, 8 families in one location, no literacy. So our field staff, like nobody in the household can write or read. So our field staff, like they're visiting those households on daily basis and asking them questions and writing this. Now, there can be a little bit of like privacy issues, and like we are also being very sensitive. We said if our field researchers see if something is people are not comfortable to write, then like we can discuss that in private, like between researchers, instead of writing that in diary. So is that what answering Nikita's question?
Yeah, I think you did probably explained it how this is not uniform, not similar across the cohort of the participants are also, between different regions. Is there any other question? I do not see much question popping up. Either you have been clarifying this so eloquently that nobody has some questions. But while we wait, but I think there are a couple of points I could perhaps add to what Francis really asked. That was very important question. I think for that research project, we have to admit that we cannot go in the field from here and execute a rigorous screening of the different participants. So the few decisions that was taken in Bangladesh, there was 6 different locations. A very early decision was taken that we'll work someone really, doing work within that location. So we're not taking multiple NGOs or multiple, anchoring point in that location. So one very local organization is to be the anchor. So we have got then 6 different locations, six different anchors who we have spoken right from the top level to their field level. But there are also important steps done is that although these 6 locations are, geographically separated, and also the way we were dealing was initially individually with the respective organization. But then towards the halfway stage of our discussion, then we all brought all of the partners together and really then establish a same basis for everyone, even the amount of field cost that's going to be supported through our project. That was uniform and agreed on a common meeting between the 6 different anchor points that for basis for each of them. And this is what we really discussed quite at length. And we made the collaboration agreement language acceptable and contributed by all of them. In the end, the whole collaboration package was, the MOU package was available to everyone. Everyone knew how much, who is responsible for doing what. So, some of these things did really, I think, help. Initially there was some kind of confusion, some anxiety among the partners, but gradually all these things became very useful. Even the local dialogue, we mentioned that the local institution, local people have the say. There we are almost like a student. Even Ehsan and myself appearing those from a distance, we never really put forward ourselves the kind of agenda to be discussed. It was purely from the locally selected participants. Nonetheless, I think there are limitations. We can see that there's things coming up that not every time that we expect that the research diary is written with the full knowledge of the family. Not every details are listed in there. So we are thinking that whether we may need some other forms of data to actually validate what's going on, what's being written in the field. I think that is what I could add. No, I do not see that there are any other questions. Reuben, you seem to have presented with a complete perfection. Is there any other question? Otherwise, I could ask Ali to come forward.
Thank you very much to Manoj, Ehsan and Reuben for a very interesting session. Nice to see teamwork both during the seminar and in the research project overall, and international partners is something that's really important here at Lancaster. So thank you very much for everything you've shared and for managing the session. Sorry I had to ask you to move around computers, but I don't think we could have handled that background noise. So thank you very much for all of that. To our audience, thank you very much for joining us and for your questions that you've put in the chat. If anyone wants to get in touch with our speakers, I'm sure you can find their email addresses through the university website, and I'm sure they'd be happy to take any more questions. So with that, I suggest we call the session to a close, and hopefully we'll see more of you again for future LEC seminars. They'll be advertised on the website. Thank you very much, everybody.
Thank you.
Thank you for listening to us. Yeah, thank you.
Thank you very much.